Have you noticed that your favorite walking shoes feel tight by 4 p.m., leaving deep red rings around your ankles? Or maybe you're exhausted from waking up 3 times a night, dragging your tired body to the bathroom only to release a flood of clear urine. You shrug it off, thinking, "I'm just getting older." But then, during a routine checkup, your doctor looks at your blood work and the room goes cold. Your hard-earned retirement plans are cancelled. Instead of living your golden years on your own terms, you'll spend 3 days a week strapped to a sterile dialysis chair, your freedom traded for a plastic tube. In my 20 years in internal medicine, I've seen this tragedy play out thousands of times. The medical system is failing you by staying silent. Most doctors wait for obvious signs like back pain, but your kidneys don't scream, they whisper. In the next few minutes, I will reveal the 9 subtle daily signs your kidneys are struggling and expose one common over-the-counter painkiller silently scarring your organs right now. To help me tailor this medical advice to your specific needs, what is your age and what daily symptoms are you currently struggling with? Drop your answers in the comments. Let's hear what your body is actually saying. Let's start with the most dangerous lie in modern geriatrics. Your blood pressure is fine for your age. You might have been told that 140/90 is normal for someone in their 70s. That is a lie. Your kidneys and your blood pressure are locked in a deadly embrace. Think of your kidneys as a delicate network of millions of microscopic coffee filters. When your blood pressure is high, it's like trying to force water through those filters with a high-pressure fire hose. Eventually, the filters tear and scar. But here is the whistleblower secret. The system often settles for good enough numbers because it's easier than fine-tuning your health. For most of you, aiming for 120/80 is the gold standard for kidney protection. However, there is a catch. If we drop your pressure too fast at age 75, you'll get dizzy when you stand up and risk a broken hip. It's a delicate balance that your primary care physician, PCP, needs to manage with precision. Are you currently tracking your numbers at home with a Medicare-approved monitor? Or are you just waiting for that one white coat reading at the clinic that is always higher anyway? We are moving to the next sign, which involves a measurement you can do with a simple piece of string. Many doctors look at your BMI, body mass index. I'm telling you to ignore it. BMI is a useless number for seniors because it doesn't account for muscle loss. The real killer is visceral fat, the hard fat hidden deep inside your belly, wrapped around your organs. This fat isn't just extra weight. It is an active chemical factory that pumps out inflammatory proteins directly into your bloodstream. These chemicals travel straight to your kidneys, causing them to leak. But don't bother with complex math or converting centimeters. Grab a tape measure from your sewing kit. The American Heart Association is clear. If you are a man, a waist circumference over 40 inches is a red flag. For women, it's 35 inches. If your belly has been growing, while your arms and legs are getting thinner, your kidneys are under siege. This is a sign of sarcopenia, where you lose muscle but gain organ-killing fat. We'll discuss how to fix this without hurting your joints later. But first, let's look at what's happening in your bathroom. 3. The Dawn Soap Signal. Next time you go to the bathroom, don't just flush. Look, if you see foam that looks like bubbles from Dawn dish soap, thick, white, and persistent, your body is sending an SOS. Your kidneys are designed to keep protein in your blood. Protein is the building block of your muscles and your immune system. When the kidneys' filters are damaged, they become leaky, and protein spills into your urine. This creates a change in surface tension, causing that dish soap foam. But here is the whistleblower twist that most miss. If you have type 2 diabetes, that foam might not just be protein, it could be sugar. When your blood sugar is too high, it spills over into the urine, creating a sticky foam. In America, diabetic kidney disease is the #1 path to the dialysis chair. If you see that foam, you don't just need a kidney test, you need to check your HbA1c levels immediately. 4. The oxygen truck metaphor. Why does walking to the mailbox suddenly feel like you've run a marathon? Most seniors think, I'm just out of shape, or I'm getting lazy. But your kidneys do more than filter waste. They produce a hormone called erythropoietin. This hormone is the work order sent to your bone marrow to create red blood cells. Think of red blood cells as Amazon Prime delivery trucks. Their only job is to deliver oxygen to your muscles and brain. When your kidneys struggle, they stop sending the work orders. The fleet of trucks disappears. This is called anemia of chronic kidney disease. Suddenly, your heart and lungs have to work twice as hard to move a tiny amount of oxygen. You aren't lazy. Your body is literally suffocating from the inside because your delivery fleet is grounded. If your stamina has plummeted over the last 6 months, don't just blame your age. Check your filters. 5. The midnight wake-up call, the flood versus the drip. Is your prostate really the reason you're waking up 3 times a night? For men, that's usually the assumption. For women, we blame a weak bladder. But your kidneys might be the true culprit. Healthy kidneys are incredibly smart. They concentrate your urine at night so you can sleep for 8 hours. When kidneys lose their function, they lose this ability. They produce large amounts of diluted clear urine all night long. Here is a clinical self-check you can do tonight. When you wake up, pay attention to the flow. The drip. If you stand in the bathroom and have to push or strain only to get a weak, narrow stream, that's usually a prostate issue. The flood. If you wake up and release a massive flood of clear, watery urine, that is a kidney warning. Your kidneys are failing to concentrate, and they are keeping you awake because they can't handle the volume. Are you seeing a flood at 3 a.m.? 6. Toxin-driven fatigue and the metallic taste. We all get tired, but kidney fatigue is different. It's what we call uremic fatigue. This isn't the kind of tired that a nap can fix. It's a deep, bone-weary exhaustion caused by a buildup of urea and toxins in your blood. When these toxins accumulate, they affect your brain. You might feel brain fog or feel like you're operating at 60% capacity. But here is the whistleblower detail that most people miss: the itch. This fatigue often comes with a persistent ramy itch, especially on your back and arms. We call this uremic pruritus. It happens because the urea waste can't get out through your urine, so it starts depositing under your skin like microscopic crystals. If you are tired and you find yourself scratching your back against a doorframe like a bear, your kidneys are drowning in waste. You might also notice a strange metallic taste in your mouth, almost like you're sucking on a copper penny. If your favorite Sunday roast suddenly tastes like metal or smells rotten, that is a massive red flag. 7. The Costco shoe. Reality. Have you ever noticed that your shoes feel tight by 4 p.m. after a trip to Costco? Or perhaps when you take off your socks at night, there is a deep red ring indented into your skin that takes 10 minutes to disappear. Most people blame the heat, but as a doctor, I see a failure of the sodium pump. Your kidneys manage the salt in your body. When they fail, salt stays in your blood, and water follows salt. Gravity pulls that extra fluid down to your ankles. This is called Pitting edema. Critical warning. If you have swelling in both ankles, it's likely your kidneys or heart. But if only one leg is swollen, red, and hot to the touch, stop this video and call 911 or go to the ER. That could be a blood clot, DVT, and it's a medical emergency. Still with me? We are about to hit the most overlooked connection in all of medicine. 8. The fluid shift and sleep apnea. Many of you have been told you snore, or you've been diagnosed with sleep apnea. You think it's just a throat issue. But remember that fluid in your ankles from the Costco trip? When you lie flat at night, that fluid doesn't disappear. It shifts. It moves from your ankles up to your neck. This is called internal edema. This fluid tanks around your airway, making it much harder to breathe. This creates a vicious cycle. The lack of oxygen during the night damages your kidneys further, which causes more fluid retention, which makes your sleep apnea worse. If you wake up with a headache every single morning, your ankles might be suffocating your throat. 9. The whistleblower's biggest secret, the NSAID silent killer. I need to tell you something that the pharmaceutical commercials on TV won't mention during the evening news. Most of you have stiff joints. You likely reach for a bottle of Advil, Motrin, or Aleve. In the medical world, we call these NSAIDs. To a 20-year-old, they are fine. To a 65-year-old, they are kidney toxins in a bottle. These medications work by blocking enzymes that cause pain, but those same enzymes are what keep the blood vessels in your kidneys open. When you take Aleve for your knee pain, you are essentially choking your kidneys. I have seen patients with healthy kidneys fall into acute failure after just 2 weeks of high-dose ibuprofen. This is the whistleblower truth. The very pills you take to stay active might be the ones that put you on a dialysis machine. If you have joint pain, switch to Tylenol, acetaminophen. If your liver is healthy, or better yet, ask your doctor about topical creams that don't enter the bloodstream. You've stayed with me this far because you value your freedom. You don't want to be a burden on your family. So, let's talk about the protocol to reverse this damage. We are not going to do a laundry list of impossible changes. We are going to use the staircase approach. Step 1. The kitchen swap, the potassium hack. Tomorrow, when you go to Walmart or Safeway, look for potassium salt, often sold as no salt. Replacing your regular table salt with this can lower your blood pressure by several points without a single extra pill. Step 2. The fiber first rule. I'm not going to tell you to never eat bread again, but I want you to eat a bowl of broccoli or a green salad before you touch the carbs. This creates a fiber net in your gut, preventing the glucose spikes that tear through your kidney filters like sandpaper. Step 3. The Medicare privilege. If you are on Medicare, you likely have the right to a remote patient monitoring device. Call your PCP and ask for a blood pressure monitor that sends data automatically to their office. It's often free and it keeps you safe. Step 4. Demand the big 2. Tests. Don't let your doctor just say, your labs look good. Ask for your eGFR, your filtration speed, and your uACR, your protein leakage score. Write these numbers down. If your eGFR is below 60, you are in the warning zone. We have covered a lot today. We've looked at the oxygen trucks, the Dawn soap in the toilet, and the Floodvis drip nighttime test. You now know more about kidney health than most people in this country. But knowledge without action is just trivia. You have spent years taking care of everyone else, your children, your career, your community. Now, it is time to take care of the silent partners that keep you independent. Your kidneys are the guardians of your freedom. They are what will allow you to stay in your own home, and drive your own car for years to come. Do not let the medical system wait until it's too late to tell you the truth. Tonight, check your ankles for that sock ring. Tomorrow, check your urine for that flood. If you found this whistleblower insight helpful, please share this video with your friends at the community center or your church. We need to wake people up. Hit the like button and subscribe so you don't miss my next deep dive into the medical truths they aren't telling you. Medical disclaimer, but I am not your personal doctor. This information is for educational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard in this video. Stay strong, stay independent, and take care of your filters. I'll see you in the next one.